My name is Emily Fredericks. I'm the pediatric nurse practitioner at the DeMott location. I've always loved kids. My first job was actually in childcare when I was in high school. I love that kids have a natural curiosity and a brave spirit. I've also loved problem solving, helping others, so pediatric healthcare was just a natural step. I have a special interest in premature babies. Before I became a nurse practitioner, I spent 6 years in the NICU working as a nurse, so I still have a passion for premature babies and all the complications that come when babies are born too early. My favorite part about being a pediatric nurse practitioner is watching kids grow, thrive, and meet exciting milestones while easing parental anxiety and providing support along the way. I love getting to know my patients and their families to be able to provide individualized care and watching those babies grow into toddlers, then little kids, big kids, teenagers, and eventually their own people. So one of the patients that I had a profound impact on was a school-aged boy who had a history of asthma. He was often in and out of the ER due to asthma attacks. He had 2 different inhalers, but wasn't really sure exactly how to use them. I remember sitting down with mom, explaining to her the difference between his 2 inhalers and how to use them properly. She was very grateful as she never understood the difference between the 2. When they started using them properly, he had no more ER visits and his asthma was relatively well controlled from that point on. A hobby of mine that might surprise people, I love spending time outside. I love hiking, kayaking, and water skiing. One thing I can't live without is chocolate. I love chocolate, any kind and anything, love it all. One of my favorite health tips actually has to do with screen time. Screens have become a huge part of our lives, obviously, but it's really important to limit them in childhood. Kids should spend the majority of their day playing and learning through play. Kids less than 2 really shouldn't be on screens at all, and after age 2, it should be limited to about an hour or 2 a day. And it's always important to make sure that the content that they're watching is safe and age appropriate. My favorite part about working for NorthShore is our inclusivity. I love that we provide care to every patient, no matter their financial ability or insurance status. We really care about every patient that comes through the door, and we try hard to meet their every need.